a healthy person under 50 years old, the recovery time from the time they get symptoms to the time they're clear to go back to work is essentially 7 to 10 days. So I know Commissioner Shea and I have talked about keeping track of who comes back on duty after they have been out, and that number will start to grow soon too. It'll always be a juggling act, but this is what we all do for a living, and certainly we're going to make sure we have the capacity we need when we need it.
Next, we have Katie from the Wall Street Journal.
Can you hear me?
Yes.
My question is about the ventilators. I'm curious, do you know where they're going to go yet? Will they only go to H&H hospitals? Will they be distributed to private hospitals that are in need? What's the process for that? And I have another one.
Yeah, the process through our emergency management will determine, obviously in consultation with the health commissioner and in consultation with the CEO of Health and Hospitals, what the needs are. The group, the 400 I mentioned earlier today, 100 went to Health and Hospitals, 300 went to a variety of voluntary hospitals across the 5 boroughs, depending on need, and we'll make those adjustments each time. So our job is to make sure that there's no hospital of any kind in the city that hits that that crucial point where they don't have a ventilator when they need one.
Thank you. And my second question is, I know for the past week there's been discussion about testing sites set up at Citi Field, or even utilizing Citi Field in the parking lot by Yankee Stadium for other uses. Is that still in the works for either a testing site, or as pointed out earlier, Queens has the most amount of cases? Would it ever be used for secondary hospital sites or anything like that?
I'll start, and I don't know if we can. Deanne is on. Okay, I'll start, and our Emergency Management Commissioner, Deanne Criswell, will jump in. Look, this is, Katie, obviously ever-changing. Testing, it would have been so valuable in the beginning to do it on a really, really broad scale. It's now, as you've heard from Dr. Barbeau, the realities of testing have changed over time. We certainly need it for folks who are most vulnerable. And to keep emergency rooms from being overwhelmed. That's where the focus is. So we'll be making those decisions, those adjustments, emergency management, working with Health and Hospitals, Health Department, FEMA. They'll be constantly figuring out where the adjustments are. But in terms of expanding hospital facilities and capacity, we're absolutely going to constantly look for additional space. Those obviously have to be either indoor spaces or places where we could best set up tents. We are always in touch with the federal government trying to see if we can get additional military support in, and that's something I sure hope will be coming over time. But the focus will be, again, wherever possible, close to existing healthcare facilities. That's the ideal, to put any new capacity near existing healthcare facilities to maximize the way you use it. Commissioner Criswell, you want to add?
Yes, thank you, Mayor. Regarding the site that we were looking at Citi Field, that was one of the places we had identified to use the FEMA drive-through sites. But we have since, and I think we briefed this yesterday or the day before, decided to co-locate all of those FEMA testing sites with our current health and hospital sites. So our supplies have all gone over there, and they are being co-located, and we're working with FEMA right now to finalize those sites. I think just to add on to what the mayor said about then possibly using it for other types of operations, I have been in touch with several members from DoD today about some of the resources that they're looking at bringing in. And we're working with them to identify, if they do and when these resources do come in, what would be the best locations that they could set up field hospitals, if that's what they are going to bring in, or other types of equipment and supplies that they might be bringing. So there's a lot of spaces out there. There's going to be a lot of, at least we hope, equipment and people coming in, and all of these spaces are going to be needed to help us support the bigger picture and the bigger response to this COVID crisis.
Next, we have Janin from Cranes.
Hello, can you hear me?
Yeah. What's the name again? I'm sorry.
Janin
Fisher with
Janin.
Yes. Hi. Yeah, this is about the small business loan program.
Yep.
I wanted to see how many businesses have applied, how many grants have been issued, and how much money has been dispersed so far. I also wanted to see how much money is in the pot to disperse the grant money. I have similar questions about the loan program. How many applied? How many loans have been?
Hey, let me just give just a helpful ground rule. I've said it to a number of your colleagues, and I want to keep repeating, even though we're trying to keep everyone to a 2-question allotment. If you could split it up, it really helps me to just be able to follow it all and give you accurate information. So,
Understood.
On the question of the small business loan and grant program, applications have come in large number, as I understand it. I know we are hitting some limits in terms of that, but I want to get you the exact details. I don't have them at my fingertips. We will absolutely be able to get them to you right away. I think it was back on Friday. I was giving details about when money would flow. My memory served some of it already, some of it by the end of the week for the 2 different programs. Both definitely have limits. I'm certain we will max out both of them. But I hope it will help a number of small businesses keep going. Of course, the big question will be, does this stimulus bill focus where it should on working people and on small business in addition to our hospital system and our local governments and state governments? Will that be really the focus, or will it be a corporate bailout more than an actual relief program for people in need? So hopefully, you'll see some relief for small business in this next stimulus. I think it's fair to say there will be at least 1 or 2 more stimulus bills after this one, given the magnitude of the crisis. So we hope there's going to be help there, because the real help the small business needs is far beyond what the city government can do. But we will get you the answers on our program and what's happened with it.
Thank you.
Next, we have Jeff Mays from The Times.
Good afternoon, Mr. Mayor. I'm wondering, you've talked a lot about the ventilators. Are you at all satisfied with the amount of other supplies that you've received from the federal government, and what else are you in need of at this point? And I have a second question.
Yeah, Deanne might be able to do the chapter and verse. My memory is the overall requests that we documented time and time again to numerous federal officials over the last 2 weeks. 15,000 ventilators. I think it's 50 million surgical masks, if I remember correctly. Deanne can fill in some of the other blanks. But Jeff, no, of course I'm not satisfied. I am pleased that there's finally a flow of real resources for New York City. I mean, literally a week ago at this time, we had seen essentially nothing. And now, there's an actual constant dialogue going on. I mean, a week ago, I believe there's only one federal secretary who, despite letters, phone calls, everything, really gave me any answer on anything. Since then, I've been talking constantly to federal officials, and they have been much more responsive and much more detailed and are actually providing answers. And we saw, obviously, today some real progress on the ventilators. But no, the day I will be satisfied is when we have such an ample supply that I am certain we can get through April and May. And we are far from that moment. What we have right now, I'm going to be blunt as I can be. I said it earlier. I'll say it again. Right now, I am satisfied we can get through this week in New York City in terms of our healthcare system. And even with that, I think some of our hospitals are going to be very stressed. I am hopeful we can get through the week after that, but I'm not convinced. And when I say get through, I mean be able to ensure that every single patient who can be saved is saved, who has coronavirus, while also addressing all the other patients with all the other serious conditions that have nothing to do with coronavirus. So because we got an infusion of help, we got a lot of help from the state. We definitely got some good help from the federal government. We've gotten a lot of help from just individuals and companies. We're going to get through this week, and we have a strong chance of getting through next week, and that's all I can guarantee you right now. So we're going to need a huge amount more. Deanne, are you able, again, from memory, or maybe you have the letter in front of you, was I right? It's 15,000 ventilators and 50 million surgical masks. Am I right so far?
Yes, Mayor, those numbers are right. We also asked for 3,095,000 masks. We are starting to see some of these supplies trickle in, and we did get a truckload or several truckloads that were delivered to the Javits Center today of some additional PPE. I don't have exactly what arrived yet. This is just late breaking news. But I really want to expand on something that the mayor said, and that is, while all of these items are really critical in order for us to be successful with this, our number one most precious commodity in all of my years of disaster experience is time, and you can't get time back. And every day that goes by that decisions aren't made and supplies don't come in are going to cost people their lives.
Well said. Very, very painful reality, but very well said, Commissioner. Okay, who's up?
Secondly,
Oh, yes.
to Mr. Mayor, about the street closings, why only do 2 streets per borough? And do you have some sort of resistance to the idea of closing streets to open up more space? Why start with so few streets?
Jeff, I'm going to very respectfully answer, but I'm also going to refer you to what I said earlier in this press conference and what I said in detail yesterday's press conference. I think I've been real clear about it. Enforcement, enforcement, enforcement. If you open up a bunch of streets and you cannot enforce because you're spreading out our resources too much into places we haven't normally had to enforce, you're going to have a problem of gatherings starting to happen and people not observing social distancing because there's no enforcement mechanism. So right now we have a huge system of parks and playgrounds people are used to going to, and we know where they are and we know how to enforce them, and that's what we're doing. But we're going to work to set up a select number of other locations, but with enforcement attached. The only way we can expand, in my view, is if we keep proving that we can enforce. So think of it as toeholds. Like first you get one thing done, then you climb to the next level, next level. If you cannot get regular presence from city agencies that are being stretched all over the place right now, if you cannot get regular eyes on and regular enforcement, you run the risk of exacerbating social distancing rather than reducing social distancing. And we do have a lot of places for people to go right now, parks, playgrounds. That's where we think the focus should be because we can monitor and we can enforce properly.
Next, we have Matthew Chase from Newsday.
Mr. Mayor and Dr. Katz, gentlemen, when I asked you a week and a half ago, you said the city didn't have a triage plan recommending like who gets care when there are limited circumstances. When I cited Italy, Mr. Mayor, you called that country a hot mess and you said we're nowhere near that. But when I asked, there were 15,000 cases in Italy. That's kind of where we're at now. Other jurisdictions, Washington states, have disclosed their plans. They call, I think it's something called like a crisis standard of care for these very difficult circumstances. So just to be clear, I'm not asking whether the plan is in effect right now, but I am asking yes or no, does New York City have such a plan? And if yes, who gets priority and who doesn't?
Matt, I'll start and Dr. Katz can jump in. Again, I couldn't be clearer about what we're trying to do right now. And until I get to the point where we can't do it, if we ever get to a point where I have to say to all of you, we cannot keep up with the number of cases, we'll say it. But the very blunt, detailed conversations we're having every single day with the people of the city is to say exactly where we are on space and personnel and supplies and equipment. And as I said, today we have what we need going into next week. So that we are not making the kinds of decisions that you're talking about. And when I referred to the situation in Italy, I was also referring to a very different trajectory than we went through, very different level of preparation. So I think you have you have creatively reinterpreted what I said and you have not accurately portrayed it. We, of course, know that we might get to a triage situation, but I don't think it's appropriate to start talking about not just a theoretical, a very painful theoretical that I don't think is fair to people to just lay out there as something that might happen when we're being real honest about the fact that if we don't get more help, we're going to be in a situation where not everyone can get what they need. I think we have to keep fighting to get the help we need to keep innovating, to have the space, to have everything we need ready. And if we ever feel there's going to be a problem beyond that, we're going to be honest about it. And of course, our hospitals know how to handle a situation like that, as difficult as it may be. So I'm not going to lay out some plan in advance because we are not at that point. Dr. Katz?
I agree. I think to lay out a plan is to accept that we're not going to have the resources that we need in order to take care of everyone. And you've been very forceful about getting us those resources, and I think we have to keep pushing for the necessary resources and believing in our amazing healthcare workers who I can tell you, Mr. Mayor, and health and hospitals have just been phenomenal in doing things that would have once seemed impossible to them, such as doubling our ICU capacity. So we are actively innovating, and I'm not at all prepared to say that we can't meet the needs of everyone.
Also for Dr. Katz and potentially for Dr. Barbeau, how many ventilators approximately does New York City have at this moment, and how many approximately again are in use for coronavirus, but also for other reasons, and ditto for hospital beds? Same questions.
Yeah, let me jump in and then they can jump in. Again, respecting the question, but this is one of your colleagues, Henry, asked a similar question. We're just not going to be giving specific answers to something that's a constantly moving target. It's not fair to New Yorkers to constantly say one thing when it could be moving in a course of hours. We said earlier in this trajectory that the estimate was somewhere in the neighborhood of 5,000 ventilators in the city. That number has grown markedly in the last 24 hours with the shipment from FEMA and the announcement of the 2,000 more that we hope to receive as early as tomorrow or the next day. And there's lots of other sources being acted on. It will be changing all the time. The way we can interpret all this to you, and the best way and the most honest way and the most effective way, is to talk about overall capacity with that simple standard. Can we serve everyone who comes in with the coronavirus and give them the care they need? That's what we're going to be reporting on constantly. But I guarantee you the number of masks, the number of ventilators, the number of hospital beds, the number of people admitted are going to be varying by the hour, and we are just not going to be in the business of updating people on that because it's not going to be sufficiently accurate. It's not fair. It's not a good use of our time. Our job is to give you the overview and be very, very honest where we are at any given point with that overview report. Doctors, you want to add?
I think you've covered it. We have enough resources, as you've said, certainly to get through March. And to get into April, and we have confidence in your abilities and FEMA and the federal government to bring us and state government the resources we need to go beyond that.
I don't have anything to add. You covered it, Mr. Mayor.
Thank you, Commissioner. Okay, who's up?
Last two, we'll take Yoav next.
Hi, Mr. Mayor. Just wondering, or maybe one of the doctors can answer this, but are there specific hospitals, either public or private, that are already or close to being in serious trouble? And I wonder if there is any value of making at least that information public, because perhaps that might change public behavior. Maybe somebody who's sick can avoid a hospital that's overrun currently and try another one.
It's a fair question, Yoav, and I appreciate it. I don't like the word overrun because I'm not trying to be semantically difficult. I'm just trying to be honest. I don't think it's a helpful word because I don't think it portrays reality. For example, Dr. Katz has been very open about the fact that there's been a disproportionately high number of cases at Elmhurst Hospital in Queens. And yet, at the same time, it's an extraordinary facility that's very well run, and they've been making constant adjustments to deal with it. I think we need to be careful. I agree with you if you had a perfect world where you could say, hey, everybody, let's, move over here, move over there. That would be wonderful. But I think what I've learned from the doctors is that's not the way healthcare works. If someone's in an emergency situation, Location, location, location becomes the issue. And also our ability to communicate to people down to that kind of micro level of here's the hospital usage levels at any given hour. I just don't think it's going to get through to people. We'll say, certainly, especially for our public hospitals, if there's something situation that we think is particularly troubling, we'll be open about that. Elmhurst has gone through a lot. Queens Hospital's gone through a lot, but they are keeping it together, particularly as we get them more supplies and personnel. But I don't think it's really easy to say, go here, don't go here, go to this other place. It just doesn't strike me as realistic. Doctors, tell me if that's accurate or not.
I think,
If I could add here, I would say that, I've been the first person to say people stay home, stay home, stay home. And that's for two reasons. One is we want to make sure that people are socially distancing. The other one is we want to maintain the capacity of all of our healthcare delivery systems and our hospitals, because we don't have to travel any longer, than they need, not only for COVID-related things, but for, as I said earlier, heart attacks, appendicitis, other things that they might need to have urgent care for. We don't want to extend the period or the length of time that they have to, or space that they have to go get care. We want to relieve the congestion of what we call the worried well, meaning people who have mild symptoms, who may have, a certain concern that they may have COVID. The reality is, as the mayor said earlier, and I've been saying, 80% of the people who get COVID will be able to ride it out at home for 3 or 4 days. And if they're not, 7 to 10 days. And if they're not better in 3 to 4 days, that's when we want them to reach out to their doctors. We need to reserve the capacity of all of our hospitals, not only for COVID, but for all of the other things that need to come in as well.
I would add on the hospital capacity that it's more appropriate for us to move resources than it is for patients to go elsewhere. Part of why people come to Elmhurst is because it has an excellent reputation as a hospital and is really well trusted by the immigrant population that surrounds it. So rather than directing patients away from it, I keep directing resources of additional nurses and additional equipment and additional physicians to the hospital.
Thanks for that. And actually following up on that issue about the distribution of resources, if the city does get to a point where all the ventilators have been distributed and other supplies, is there going to be a sharing of resources for whoever needs it at that point? I guess I'm wondering if there's going to be kind of no distinction between private and public hospitals at that point if the materials that are in short supply need to go, to a particular facility.
Yeah, this is something I've talked to the governor about. We are absolutely united in that point, that there's no lines at this point between the public and the private hospitals. I mean, as I mentioned, our emergency management warehouse had 400 ventilators. We didn't say, oh, we're going to just, keep them just for health and hospitals. We made sure they went where the need is greatest. Health and hospitals has close relationships with a lot of the hospitals in the voluntary system. People and the doctors can speak to this, but the anticipation absolutely is that you'll see equipment moved among them if needed, because what we cannot have is a situation where any hospital doesn't have the basics. And so we'll keep mixing and matching literally day by day, hour by hour, to stay ahead of the situation. Dr. Katz, you want to add?
No, I think you covered it, sir. Thank you.
Okay. Who's left?
Last question is Julia at the Post.
Hi, Mr. Mayor. Can you hear me?
Yes, indeed. How you doing?
Good. How are you?
Good.
So 2 quick questions here. Can you tell me when the city was notified that you'd be getting half of the 4,000 new ventilators? Specifically, I'm wondering if it was before or after the governor's press briefing discussing the dire need.
Yeah, Julia, I want to just caution you. I've noticed asking these very fine-tuned, like who knew what when questions are perfectly fair questions, but I really am trying to be as honest as I can be about how Things are changing, by the hour, even by less constantly. I heard the confirmed information that 2,000 would get to New York City just before coming out here. So sometime, in maybe 3:15, 3:30, something like that. Because we had first heard the state allotment, we did not hear if a certain amount was being determined specifically for New York City. So that's my impression. It only came into us after 3 p.m.
Okay, thank you. And then a second question. I know you and Dr. Katz have said that you can make any hospital bed into an ICU bed, but given that our ICU cases are escalating in the city, can you just give us a sense of what the current landscape looks like in terms of ICU beds? I've seen reports out there that range from 1,000 to 2,000.
What are you trying? I'm sorry. I want to make sure I understand your question. What is, when you say 1,000 to 2,000, what are you trying to say?
What is the current number of ICU beds in New York City?
Similar point. Again, I'm going to be very rigid about this, which is we have an ever-changing situation. The way we are grading this is overall capacity. This is so fluid, I cannot even begin to describe it to you. So what Dr. Katz said from the beginning, he could take any part or almost any part of his hospital and turn it into an ICU. And what you're going to see is the hospitals more and more will expand ICU capacity. A lot of other type of capacity will go over into other places, whether it's the Javits Center, whether it's hotels, whatever we're able to stand up. But I'm not going to give ever a number that is a moving target. I'm going to talk about what we can do to serve people. If we're confident we have the capacity to serve people at any given hour, that's what I'll say. If we are not confident of that, I will say that too. If we're not confident at any particular place, I will say that. But I'm not doing a running count. It's just not responsible or fair given the ever-changing situation.
Supplies.
Again?
But not beds. But you can do a running count of medical supplies, but not beds?
Again, I'm telling you that I got the question on medical supplies a moment ago too, and I said we'd give very broad figures, but we're not. Those figures are changing all the time too. We have determined, this is just the way we're going to do it, that we're not going to say something that could easily be misunderstood and that's ever changing. We're going to talk in terms of ability to serve people. Everything is changing by the hour. Thank you very much, everybody.